Hello and good afternoon. Welcome to another live session with me, James. Neethu's Academy live just for you. So, how are things with you? Were you all waiting? As always, I know that you're all waiting. Is it there? So, tell me, how are things with you? How is your preparation going? It's another important thing that every day I would definitely want to make myself updated on the aspect. നിങ്ങൾ എങ്ങനെ prepare ചെയ്യുന്നു എന്നുള്ളൊരു ചോദ്യം. How are you keeping yourself updated? Okay, and how many of you have kept a goal on the aspect saying that, okay, this is the day that I'm going to write my exam? I know that there are lots of myths. So, just to ready എന്ന് പറയാൻ വേണ്ടി ഒരു thumbs up ഇട്ടാൽ ഡേറ്റ് ഒന്നും പറയണ്ട. Just yeah, how many of you are ready? Anil Gopalakrishnan, hi. Soumya, good afternoon. So I'm sure that all of you have kept a deadline for you. Jean Maria, good afternoon. Okay. So എല്ലാവരും ഒരു ഡേറ്റ് മനസ്സിൽ കണ്ടിട്ടുണ്ടാവണമല്ലോ അല്ലേ? You should have that book. ഇതിന് ഇല്ലാത്തവര് see, don't Ullas Jose after a long time. Good afternoon, sir. Anit Korean, good afternoon. Good to see a lot of known names. Kajal Rashad, good afternoon. Oh, Kajal is ready with the date. Okay, excellent. Good. I always love those people who have that focus in their life. You should always have that and work for it. അതിൽ ഏറ്റവും നല്ലത് ഒരു സെറ്റ് ടാർഗറ്റ് വർക്ക് then push yourself to get that. Elizabeth Joes, good afternoon. Chestnut Noble, good afternoon. Happy to see you always. So again, people who are new, there are lots of people who are entering new but not telling me that they're new, but still. Reshmi Raghu, good afternoon. If you're new, Agnes Rwanda, isn't it? If I'm not mistaken. Diula Jobin, good afternoon. So if you're new, please do understand that Neethu's Academy only have 2 Telegram groups. One is what we have just pinned in here. Okay, that's the official Neethu's Academy Telegram page. Arya Gina, good afternoon. And then we have an exclusive reading Telegram. These are the only 2 groups that we have. Okay, there is no separate group for listening. There is no separate group for writing, nothing like that. So if there is anybody who's contacting you for such kind of thing, be aware those are fraud. Okay, now why I keep on telling this, you have to be aware this is an online platform and you will be contacted with a lot of fraudulent people who are not genuine. Okay, who was only here to rip your money. So be aware of such kind of people again and again. Do not go behind such kind of message. If they ask you, Prince K. Matthew, good afternoon. Shanila, good afternoon. Priya Nair, good afternoon. Neethu Binoy, good afternoon. If they ask you to send message and all those things, do not just ban them. Straight away ban them. Okay, that's the safest thing that you can do. Rashmi Vinesh, good afternoon. Lynette Joseph, good afternoon. So very good afternoon to each one of you. Ambili Jinu, good afternoon. And very sorry if I've missed your name. Okay, it's not deliberate at all. Okay, as the name just pops up, it's I'm a bit too slow, I think. Anu Jacob, good afternoon. Anaga Anus, good afternoon. Joyce Saji, good afternoon. So very good afternoon to all my lovely students. Ramya Gopi, good afternoon. It's so nice to, even though you're all there at the very same place, it's all a virtual reality, but I can literally feel that all of you are right in front of me. So what are the things that we offer for you? Anu, good afternoon. The only thing that Neethu's Academy is always focused is on the aspect of coming and making sure that you attain your dream. That's the only thing that we want to hear. Rekha Stalin, good afternoon. Thomas Casey, good afternoon. Sheba, good afternoon. Atira Lakshmi, good afternoon. So that's what we are. And that Christy Paul, hi sir. Hi Christy. So these are the things that we deliberately focus on. We want to be that bridge between you and your dream. Okay, there are lots of students, so we have seen that they have reached their dream destination. So We would definitely expect all of you who are in front of us to make sure that you reach your dream destination. So what are we going to do in here? Okay, we will be only talking about Prince. Hi, Anju Devasya, good afternoon. So what are we going to do? We'll be discussing two things. One, a part A, and the other one is a part B. Simi Nibu, good afternoon. So apart from that, there are certain things that I would like to bring to your attention. See, if you are new to, you don't know how to deal with listening, Chris sir comes in front of you with his listening classes, and that will be there. Drishya Nitin, good afternoon. That will be there in the very same page that we have pinned, the Telegram group that we have pinned. The link to the Zoom that happens on the Zoom. So he will take classes on Zoom. So you have to be aware that it's always on the basis of first in, first out. There's no priority. Sheila, good afternoon. So the sooner the stipulated period of, the stipulated number of students enter, that will be done. Okay, so that is there. Every day we post a grammar challenge and Neethu Madam's live classes link, and all the other details that we want to give you will be shared in the very same link. Sapna Damodar, good afternoon. And then we have an exclusive reading Telegram page that is only for reading. And the first 10 information about all the Neethu's Academy material will be posted there, and you will be the first person to get that. Okay, and one small request that I always have for each one of you is, if you're not subscribed to the channel that you're watching, please do subscribe, click the bell icon. If you're not yet liked our page that you're watching, please do like the page, please do follow us so that you will not miss any of the important information that we are sharing or any live classes that we are going. Marinum, good afternoon. So this is how Neethus Academy works. So we are there for you. And that is why we have few other linguistic exams as well available for you. So if you want to get that, please do contact our admin. They will be happy to assist you. Ashwati Shivan, good afternoon. Prince Vijay, good afternoon. And on top of that, we have regular classes. And as you can see that our next regular classes, the slots are only available from June, July, August batch. That shows the number of students who are literally wishing to wait to join with us. Jeba Shiny, good afternoon. Nimmi Jensen, good afternoon. Because we want to be that impact in your life. Okay, and if you're not having so much of time, we have crash courses available. We have all the other language trainings available. So if you need more insight, please do give a call to the number that we posted. Sanju Shine, good afternoon. So are you all ready to go for the first part of it? We'll be talking about a part B question. We'll be sharing that question on the screen, and each question, you will be doing one question, and that question will have 2 minutes. So 2 minutes samay mein therlu. That is to make sure that you are getting used to this time pressure. Sunny Sam, good afternoon. Shaila Binu, good afternoon. So how many of you are ready? Can you give me a very quick thumbs up saying that you are all ready? Anju Sijin, good afternoon. Ambili is always ready. Very good. I want one more request is make sure that you share the very same link that you're sharing. See, please do share it in the social media platform that you're using. Because we know that you're all so much, indulged with, and you are all there in the social media platform. So please do share so that another student can also see that and be of benefit. Lynette, Saumya, Jean Maria, Reshmi, Elizabeth, Drishya, all are ready. Very good. I would definitely expect all these participation when you are asked to shoot the answers as well. Yeah, Marinum is ready. So, and also please do that nobility of sharing the link. Yeah. As you have said that you're ready, Anju Davis is ready, Anu Jacob is ready. So no sooner you will see the question. There you have the question on the screen. Please do the material and then we'll discuss. There you have the time. Just as always, it doesn't wait for anyone. So I hope all of you have got an answer with you. Yes. So please do type your answer and where you got the answer. That's very important for us. നിങ്ങൾക്ക് അത് എവിടെ നിന്ന് കിട്ടി എന്താണ് നിങ്ങളുടെ ആൻസർ ഒന്ന് കമന്റ് ചെയ്യാമോ Merin done very good. I always appreciate a student who tells me everything on the first thing. It's not that that's the only person, but yeah, of course. Sindhu Gigi, good afternoon, because that takes a challenge on to be the first, isn't it? The first one to tell in front of the public. Anu Jacob B, okay, good enough. Anju Devasya done. Anu Anil done. Thomas KCB. Anju Sijin done. Can you tell me? Because I can only see B only popping up. So where you have got the answer is also very important for me. Neethu Binoy B. Ashwati Shivan B. Rekha Stalin C. Okay, now I have another answer. Elizabeth Jose B. Alright. Anu Anil C. There you have. Simi Nibu B. Okay, the majority is B. But of course there is C as well. Liba Libin C. Reshmi Raghu B. I mean, I like this. B, C, B, C. Okay, fair enough. Reshmi Raghu, yeah. B. Thomas A can be eliminated. Okay, fair enough. Anju Devasya C. Sapna Damodar C. Sorry, B. Ambili C from first few lines. Okay, fair enough. Jasna B from last few lines. Okay, I like that. Reshmi Vinesh C. Jean Maria C first sentence. Okay. Saumya Shijo C. All right. Sanila B. Drishya B. Anju Sijin C from first two lines. Anju Devasya first few lines. Okay. Anu Anil C from first sentence. Okay, fair enough. So I definitely appreciate your participation, but even though it's not the complete people have told, but still, very, very kind of you for all the people who are commenting. Okay, thank you very much for that, because that's the support that we need. Okay, because as we always mention, we are there for you. We always consider you to be a patron. So that support is very, very, very important for us. Jaimol Raju, B. Sindhu, C. Right. Right, so it's a mix of B and C, although B is having a bit of an advantage when you really weigh between. Yeah. Now let's see. Okay, when you're doing part B, the first and the foremost important thing that you have to always remember is you should not read the paragraph. Not for any other reason, but to manage time. So the first thing that you read is you read the question, underline the keywords of the question, understand the question. Very, very, very important. After that, you have two options. You can read the passage and then pick an answer. Or if you're like me, I read my answer option, then I pick it up from the passage. Either way is fine. But whatever the way that you have decided, stick to it. That is very important. Okay. Now let's see. What is the question asking you for? The question will be coming onto the screen. Don't worry. Okay. Now the question is very simple, and part B, the strategy is elimination method, and you will only have one type of question that you have to encounter. It's a multiple choice question where you have three options. You have 6 different questions, and each of the question will have different focus. Okay, so here the question remains very simple. What does the report indicate? So you can understand from the question that it is a report, and what is it indicating? That means showing. Option A, there has been recent increase in the incidence of myositis worldwide. So my keywords there is recent increase myositis. Okay. Now option B, infection of the skeletal muscles. So are they indicating the infections of skeletal muscles? Or see, most common in tropical areas, but can also occur in temperate zones. So clearly it is talking about two different zones where it can occur. So tropical area, occur, temperate zone. So these are the two things. Now I'm going to read the passage and to see if I can eliminate any of these. So primary infection of muscle. So that is, what is primary infection of muscle. Now, primary infection of muscle is usually regarded as a tropical disease. So what are they saying? Generally, it is known as a tropical disease, and it's rare, although becoming more common in temperate climate. So very straight entry saying that it is a disease of tropical, but now it is also very common in temperate zones. Now, a review of the 230 cases of primary obturator myositis which has been reported. Now they're going into the report. Out of the 230 cases, shows that 82% were children under 18 years old. The median age, median means average, is 9.5 years, 3 to 46, with a male-female ratio of approximately 3:2. So they're talking about from that study, okay, this is what has been happened. And then this is what the age is, average age. The median duration of symptom prior to presentation was 3 days. So initially they say it was 3 days, but the almost common symptom was fever, hip, thigh pain, inability to fully bear weight. In 41%, there was a history of recent trauma to the hip, such as a fall or a strenuous exercise. Local trauma is recognized initiating factor of pyomyositis and is documented between 21% and 66% of cases. So then, what is the report indicating? The report is indicating there has been recent increase in the incidence of myositis worldwide as a straight eliminator because it is nowhere mentioned. Now, infection of skeletal muscle. You are talking about infection. What is infection? What is infection? Is it really mentioned anywhere in the paragraph? Because for me, when you really look into, see, please be aware of it. Part B should be mentioned in the paragraph. Where is it saying that infection of the skeletal muscle? People who have got B. I'm quite surprised at you because this is you're pushing or you're putting your knowledge into it. Understand? See, the whole ideology behind part B is not to infer. Please do not infer. Do not assume things in part B. That is there in part C, not in part B. Part B, the answer should be mentioned in a paraphrase form in the paragraph. So, infection of skeletal muscle is something which is not mentioned in the paragraph. So, the B is a straight eliminator again. Now, what is the only thing that is mentioned? The first sentence gives you the answer. Primary infection of muscle is usually regarded as a tropical disease. So they're saying it is generally considered to be a disease of tropical disease and is rare, although becoming more common. So what is it indicating? It is clearly indicating the most common tropical areas, but can occur in temperate zone. That's all what the report has been showing it to us. And then they are saying how they have assessed it. Clear? Now there are two, I wouldn't say humongous word, but yeah, it is a very common word which keeps on coming, especially in part B. One is strenuous, that is an adjective requiring or using effort of great effort and exertion and arduous task, difficult, demanding. So in Malayalam you say prayasagaramaya. Yeah? Sorry, prayasagaramaya is what you say that in Malayalam. And the other one is initiating. See, that's a verb and it says process or an action to begin, to commence. Okay, initiate. So it is like begin. Understood? So I'm sure that all of you have got B. You have just gone and used your knowledge into it. No, we have not mentioned anything about the skeletal muscle infection. The infections of the skeletal muscle is no mention. Clear? Absolutely. Keep on dancing. Do enjoy your achievements, isn't it? You have to grab all these accolades and grab it, and that makes you more competent, more confident with your innate ability. Very good. I could see all of you. I love all of you when you keep on dancing and you have to enjoy it. Okay, good enough. So, is there any doubts that you want me to clarify with regards to part B? Saumya, Liba, Anjudevasya, Reshmi, Anu, Ambili, all are dancing. Keep on dancing. Saumya, Shijo. Excellent. Anything that you want me to clarify? Yes? No? I'm sure that you don't. So let's go into the next one, which is the next thing that we have already shared. Okay. Now, before going into the next one, it's very much appreciated on the aspect how you felt about the material. What is today's material? Give us some feed, because your comment is something that we take with the highest priority. Okay, if you could recall back, I told you a student just messaged me saying that, okay, I have to include a lot of other, what do you call, treatment conditions and all those things. So we have incorporated it. See, we always are there for you. So whatever that you want, we'll try to incorporate. It was more of a disease condition, then they wanted some, what do you call, procedure kind of thing. We have incorporated it, isn't it? So it's all because of your valid comment. So please do not refrain yourself from commenting. Torah synthesis, okay, fair enough, Anu. How you felt about the material? Give us some real feed on the aspect of how you felt. Little tricky, Reshmi Vinesh, okay, fair enough. Rinsi Raju, good afternoon. All known names for me, yeah, that's why. Very few new names, but nobody have told me that you're new, so it's fine. Anit Korean, Torah synthesis. How did you feel about the material? Just now, bit confusing 1 to 7, okay? Elizabeth Joyce, Torah synthesis. Give us some insight about how you felt, because you are our patrons. Sanila, difficult, okay, fair enough. Anju Sijil, 1 to 7 is tricky. Bit difficult, Ambili, okay, fair enough. Simi, Torah synthesis. See, it's not Torah synthesis, it's not 2 words, yeah, it's just 1 word. Why I'm telling you, see, our responsibility is to make sure that we correct you, isn't it? That's all. I know maybe it's a typo, but still. Jean Maria 1 to 7, bit confusing. Anu and easy material, but questions tricky. Fair enough, I like that. Donna Shine, a little bit difficult. 1 to 7, but able to do it. Okay, Soumya, fair enough. See, this is all what it is, isn't it? You are able to do it. As simple as that. Good. Now, are you all ready for the 20 answers? If so, give me a quick thumbs up. And also, please do share. How many of you have shared and how many of you haven't shared? Please do share. And how many of you have not yet liked our page, not yet followed our page, or not yet subscribed to our page? Please do. Sindhu Gigi, confused. All right. Now let's go into questions. Okay. So 20 questions, 15 minutes. 3 types of question, 1 to 7 massive following, 8 to 14 short answer question, 15 to 20 is fill in the next question. So all those insights about, okay, ready. This is what the absolute happiness that comes in front of you. Whenever you are asking something, you get that instant reply from you. That's highly appreciated. Now let's go into question number 1 to 7, which is match the following of Torah synthesis. So, see, please do understand. In part A, it's purely keyword reference. Okay, just underline the keywords. You will find that some word as such, some word in a paraphrase form. That's the only way. Okay, so go along with the proximity. Now let's see, I'll show you. Instances that many insist to conduct imaging other than revelation of symptoms. So instances, conduct, revelation, symptoms. So where are they talking about instances, revelation, symptoms? Is as such mentioned. If you really look into text C, all those things are talking about symptoms and how it has been, because the diagnosis, isn't it? They are talking about X-ray, they're talking about all the imaging things. So the answer is C. Okay. Question 2. When should one assume the chance of occurrence of tuberculosis? So very straight answer. Keyword is tuberculosis. Assume. So where are they talking about tuberculosis? That's the first thing. So if you would have skimmed, you would really know where you would have underlined it. So tuberculosis as such mentioned only in text D. Understood? This is how you would see if effusion is lymphocytic, test for markers of tuberculosis. So it's a very straight answer. This is called keyword reference. Tuberculosis as such mentioned there. Yeah. Question 3. Factors that led someone to go after Torah synthesis. So clearly factors led go Torah synthesis. So what are the factors? Common reasons to have photosynthesis done include, so that means what makes you do. So that's how you refer. The answer is A. Question 4. Follow-ups to be taken if someone had gone through photosynthesis. So follow-ups, photosynthesis. So where is it talking about all the follow-ups? So follow-ups again is as such mentioned only in text. See, what are the things that you should do once you receive something? Everything is mentioned in text C. So the answer is C. Question 4. The feeling experienced when the fluid is taken out of the pleural space. So feeling, fluid, out. So where are they talking about? The feeling that you get once the fluid is taken. See, it is also mentioned in, it is only mentioned in text B. You may feel pressure or discomfort while they take the fluid out, but it shouldn't be painful. Tell your provider if you have chest pain or feel short of breath or faint. So the answer is B. Question 6. What is the best comparison for the pleural fluid for its flawless function inside lungs? So best comparison pleural fluid inside lungs. So where are they talking? It is as such mentioned, if you really look into, it's there. Where is it? It is compared to the hinge, isn't it? So just like a hinge needs oil to help the door move smoothly, your lungs needs pleural fluid to help you breathe. So what is the comparison? It's compared to the hinges. So the answer is A. Question 7. Range of pleural fluid that determines the increased amount of the same. So range determines amount. So where are they talking about? Range is determining. So it is all those ranges are mentioned only in text D. So it is a ratio of pleural fluid to serum protein. It is giving a range. Then it should be between upper limit to normal serum. All those ranges are mentioned in text D only. So that wraps up 1 to 7. Please be kind enough to tell me what is your total score. In the meantime, 8 to 14, short answer question where you're expected to write. The answer can be as simple as that of a word, a number, a combination of both, or a short phrase. You will not have longer answers as such what you had before. That's the latest update that you have. So again, I repeat, if you are still aware of what to do, what not to do, we have done an exclusive video on Part A tips and tricks. Please do watch it after this live and you will get more insight about it. So question 8, the condition other than an infection lead to the cause of pleural effusion. So condition, infection, pleural effusion. So where are they talking about? Condition. The condition is as mentioned in text A, cancer. If cancer may be the causing pleural effusion, your provider may test your pleural fluid for cancer cells. So the answer is cancer. CANCER. Question 9. The ultimate management to be done if the effusion persists more than 3 days. So numbers are always a keyword. So ultimate management, effusion, 3 days. So where are they talking about 3 days effusion? Effusion is there in text D, the flow chart. So where is it talking about 3 days? If effusion persists greater than 3 days, then the arrow is showing to thoraccentesis. So the answer is thoraccentesis. THORACENTESI. Sorry, THORACENTESIS. Yeah, because suddenly Merin, just I think if it's a spelling error, no problem. I mean, no problem in the sense if it's a typo. If you have written it with the A, it's wrong. Yeah. Question 10. Condition that develops as a complication of thoraccentesis, which displays difficulty. So clearly, condition, complication, display difficulty. So where are they talking about the condition that displays difficulty? So it's as such mentioned, if you really look into in text C, the second paragraph, you might need to get medical imaging after if your symptoms suggest that you might have a complication from thoraccentesis, such as shortness of breath or chest from So what is the condition? Pneumothorax. So PNEUMOTHORAX is the answer. So question number 11. The sample that has to be taken to assess cause of an infection. So very specifically saying sample taken, infection. So where are they talking about all these sample taken and what is it? It's as such mentioned in infection is only mentioned. I know that infection is mentioned as a paragraph in text A. So what is it? Sample taken. Test on a pleural fluid can help you find the cause of infection. So what is that? The answer is pleural fluid. Pleuralfluid. Two-word answer. Question 12. Ascertaining of the conducted procedure could be achieved through analyzing. So ascertaining, that means confirming conducted procedure through analyzing. So what can you analyze, or where? Analyzing, again, diagnosis. See somewhere. So where are they saying? Some institution also get chest x-rays for their patient even if they aren't having any symptom, just to be sure everything went well. So what is the thing that they're doing? They're taking chest x-rays. As a two-word answer, why x-ray is a hyphenated word. So chest, C-H-E-S-T, X hyphen R-A-Y-S. Excellent, Donna. A particular condition that can be excluded if there is no establishment of the cause. So very specifically, condition excluded, no establishment. So where are they talking about condition, no establishment? So it's as such mentioned, where it's there in the very last part of the flow chart. If no cause established, so that is what the paraphrase one is, excluded, no establishment of cause, rule out pulmonary embolus. So what is the condition? PULMONARY EMBOLUS. Excellent. So question 14, the ultimate one of short answer one. What is applied on your back post to draping the area as a part of cleaning? So applied back draping. So what is done? If you really look into, you should be aware of it. It's there as antiseptic, and where you get that in B under the bulleted point. Third one, clean part of your back, again keyword as such, with antiseptic and cover the area with a drape. So draping in here. So again referred. So antiseptic, ANTISEPTIC. So now for the final stint of fill in the blanks 15 to 20. Again the answers remain the same: short word, number, combination of both, short phrase. People do receive dash just to assess the presence of any remaining fluid. So people receive. So receiving, where are they talking about? It should be there in text C, the very last point of text C. Sometimes people also receive, again receiving medical imaging after thoracentesis to assess any remaining fluid. So what is the answer? Medical imaging. Two-word answer, MEDICALIMAGING. Question 16. A small dash is made on your skin and insert another needle between your ribs to take out fluid. You know what is the name of it, but the question is a small what? Okay, as simple as that. So again, it is there in text B, the penultimate point. Make a small cut in your skin or incision. So you can write any of these answers. It can be a cut or it can be incision. Both are okay. Okay. So question 17. Patient can be kept under dash if there is no increase of pleural fluid more than 10 mm thick or ultrasonography. So where is it talking about ultrasonography? Where is it talking about 10 mm? So very straight. Where? Under observation. So where is it? It's there again in the chart. Plural. If they say 10 mm is there only greater than 10 mm, our question is no. So observation. The flowchart is pointing into observation. So OBSERVATION. Question 18. The dash needs pleural fluid as an assistant in breath. Just like a hinge needs oil to get it. You know where it is, isn't it? So we have to just find what is missing. The only thing missing is lungs. LUNGS. The penultimate one for today. If the level of pleural fluid protein to serum is greater than dash, then exudate glucose level, cytologic analysis and culture. So you know that, okay, it should be there. Serum and all those things is only mentioned in text D. So what is the greater than is already mentioned in the question. So it's clearly saying not 0.6. So the answer should be, the fill in the blank should only be with not 0.6. The ultimate question for today. Even if you're dash, you need to get monitor after thoracentesis and then make it generate several complications. So even if you are an outpatient, is a one word answer, OUTPATIENT. Where do you get that? You get that from the very first part of text B, the first paragraph. People need to be monitored after getting thoracentesis, even if you are having the procedures as an outpatient. So I have wrapped my 20. It's high time that you tell me what are your total scores, and let me see how many of you have got. Yeah, all of you are saying the right answers. So yeah, in between 1 to 7 was somewhere that you have missed a few marks. 18, Donna, excellent. Donna was the first. I mean, great cast. 18, excellent. Good enough, good enough. Come on, go on, go on. Give me all your scores. Jasna, 18, excellent. Good enough, good enough. Reshmi, Vinish, 16, good enough, good enough. Saumya Shijo, 17, good enough, good enough. Excellent, keep it up. Good, good, good. Anu Jacob, 17, good enough, keep it up. Neelimha Anuraj, hi sir, I cracked 280. Thank you so much for your support, and your classes were very effective. Listening with 370, reading 360, speaking 360, writing 320, and absolutely good enough. Neelima, it's all your hard work. Thank you so much for coming and telling. Congratulations. My heart filled. All the very best for your fruitful journey to your dream country. All right. Make sure that God bless you abundantly. Do enjoy, and thank you once again for remembering us and telling us this amazing thing that has happened to you on your big day of exam. Good, good. So this is absolutely a morale booster for all the other lovely students who are there in front, because they would also want to come and tell one day that I have also achieved or I have made my dream a reality. Very good, Neelima. Absolutely superb. Great scores. Yeah. Very, very, very good. Keep it up. Sindhu, 16. Good enough. Swapnamo, 17. Elizabeth, 17. Dona, yeah. Take all the congratulations from all our students. Neelima, thank you. Keep on dancing. Yeah, I love students who enjoy their achievement. Keep it up. Jean Maria, 17. Yeah, take all these congratulations from all our dear students as well. Excellent, excellent, excellent. Keep it up, keep it up. So, and this is Neelima is again another person who are, an absolute crown for us. Because, see, any student who clears the golden feather from our, so good enough, good enough. Merin 15, fair enough. So is there any general doubt that you want me to clear? And the scores is absolutely stunning, isn't it? 370, 360, 360, 320. Soumya, thank you. So as you have started saying thank you. Neelima, once again, God bless you. Do enjoy your fruitful life. Okay? Soumya, Shijo, thank you for all those bouquet of flowers. Reshma, congratulations. Yeah, take all this congratulations from all our lovely students. Okay, they are all. This is one amazing thing that what we do as family. See, any one of us gets that, all of us are so happy. So that is what the most remarkable thing about coming and being with all of you. You all treat us like a family, as we always treat you like family. So this is what family is for. So thank you very much for giving me another opportunity to come in front of you, and also on behalf of Neethu's family and all of us in the family, even though there is no need of saying thank you, but it's I have to say from the bottom of my heart, thank you so much for giving us an opportunity. Until I see you tomorrow, adios from me. God bless you all. Take care.